Officials in the Democratic Republic of Congo have declared a new outbreak of Ebola. They confirmed 2 cases of the virus in the northwestern part of the country. Health officials are also investigating 17 deaths that may also be linked to Ebola. Teams from the World Health Organization and Doctors Without Borders are working with the Congolese government to investigate the cause of the outbreak. CBS News Chief Medical Correspondent Dr. Jon LaPook joins me now. All right, so John, a lot of folks remember back in 2014, there was this outbreak in Guinea, Liberia, and Sierra Leone. More than 11,000 people were killed. Is there a concern that the outbreak that we're seeing now could be as serious as that eventually?
Well, I spoke to the CDC just this afternoon, and they are concerned. They're all over this. They have a field office already there. They're working with the WHO. There have been lessons learned from past outbreaks, especially 2014, which means you have to just jump on it. You have to do standard epidemiologic techniques, meaning you identify who's been infected, you make sure that they're not in contact with other people, and you figure out who they've been in contact with, because it's very infectious. You know, you contract it by close contact with people, bodily fluids. The incubation period is anywhere from 2 to 21 days, so that means somebody could theoretically get infected, not realize they're infected, travel to another part of the world. That's what happened with Thomas Eric Duncan, who came from Africa, you'll remember, in 2014, and ended up dying in Dallas and setting off all the panic in the United States.
Absolutely. What are the symptoms? You talked about the disease spreading through close contact bodily fluids, but what are some of the symptoms of this?
Well, they're a virus. There's nausea, vomiting, diarrhea, headache, fever, and a very serious complication is bleeding. So there's problems with the way you clot your blood, and you can have hemorrhage.
Well, what can the Congolese government and the World Health Organization do to try to contain this outbreak?
Well, education is very important. So you may remember back in 2014, there were customs that were being done, for example, handling bodies of people who had died, and then people got infected that way. So making sure that people in the villages themselves, the leaders of the villages, that you don't ignore them, you don't go around them, you go through them, you go to them, and you explain what's going on, and then they can explain to the people what you need to do. This is in a rural area. You hope that you contain it, but they're taking it very, very seriously, because there is the potential for somebody to become infected and then go to another part of the world and spread it there.
I think so many people remember those images from 2014. I want to ask you about another topic. An independent panel of medical experts released new guidelines about a blood test for prostate cancer screening. Tell us more about that.
So this has been very, very controversial over the years. It's called the PSA. It's not public service announcement, which, and the reason why I say that is some people think it is. Okay, it's prostatic specific antigen. It's a blood test that reflects what's going on, a protein in the prostate. Now, when it's elevated, it can be elevated from a number of causes. That's sort of the confusing thing, because it could be elevated with prostate cancer, but it could also be elevated with prostatitis, just an inflammation of the prostate, from even something like riding a bicycle very vigorously, or from having sex the night before. So you need to really interpret it very carefully. And back in 2012, they said, you know, this is so confusing, and that getting it has led to so many unnecessary testing and people getting harmed from this testing and unnecessary operations, that we're going to say, don't do it at all. We're saying don't test. Now they're revising that based on further information as studies have gone out longer and longer, and they say, well, ages 55 to 69, talk to your doctor about it and have a conversation about whether or not it makes sense for you based on your risk tolerance, your value system.
So what is your recommendation for men who need a prostate cancer screening?
Well, they have to think about this. About 11%, and I just spoke to the CDC, these are the latest figures, and the NIH, I should say, the National Institutes of Health and the National Cancer Institute. The latest figures are that about 11% of men will be diagnosed with prostate cancer in their lifetime. But of those 11%, 80% will die of something else. So the problem is figuring out which are the 20% who are going to go on to have symptoms or die of their prostate cancer, and which are the 80% who, you know, you might as well do nothing because they're going to die of something else.
Because it's so slow growing,
it can be slow growing in a lot of cases. In some cases, I have a friend who died, you know, at the age of 50 of prostate cancer. It can be very quick. So that's the problem. And rather than saying, you know, there's a big phrase that we're overdiagnosing, and I've spoken to a urologist about this, who say, okay, it's not so much that we're overdiagnosing, we're overtreating.
I see.
So that if you do have somebody who has an elevated PSA, then don't just jump into taking the prostate out or even doing a biopsy. You may want to repeat it. You may want to do other testing. You may want to do an ultrasound to take a look at the prostate, or even an MRI, which is even more specialized testing. And then if you do end up getting a biopsy that shows prostate cancer, these days about 40% of men, if it's a low-risk type of prostate cancer, which many are, they're just doing active surveillance, which means that you actively follow it, you see how it's doing, you may do a repeat biopsy, but you don't jump in to doing treatment. So now it's a matter of your risk tolerance. You know, there's a breast cancer specialist, Freya Schnabel, who gave me this analogy, said, you know, when people come to her with early-stage breast cancer, she talks to them when they say, well, they want to do a double mastectomy. What's your risk tolerance? There are some people who, if you don't want to get hit by a car, never cross the street. But then there are other people who say, okay, I'm going to cross the street, but these are the things I'm going to do. I'm going to look both ways. And so it's a matter of what your individual risk tolerance is, and I think that helps to decide what your decision is going to be about whether to get the test in the first place, and then if you do have a positive, what to do with it. There are special cases, so African American men have a higher risk. There's about more than twice the chance of dying from prostate cancer. People with a family history and people with certain genetic problems like BRCA have a higher incidence of prostate cancer. So if you have that in your family, if you have that in your medical profile, then you may want to have another discussion with your doctor about whether you should have testing even earlier.
So many factors to consider.
It ain't easy.
It ain't easy. All right, Dr. Jon LaPook, thank you so much, John.